Hello and welcome to today's webinar. A little housekeeping before we begin. Everyone is muted during the webinar. All webinars will be recorded and sent out to all attendees after the webinar has concluded. Tomorrow, the recorded webinar will be sent to all participants. There will be a Q&A at the end of the presentation, but please feel free to ask questions during the webinar by clicking on the Q&A box at the bottom of your screen. Once the presentation concludes, Alejandra will ask the questions presented in the Q&A box. We may not get to everyone's questions, but we will do our best. With that being said, I would like to introduce you to Ruben Franco, President and CEO of the Orange County Hispanic Chamber of Commerce. Ruben, you're on mute.
Thank you, Edna, and thank you everybody for being on today's webinar, important webinar on COVID-19 and the vaccines and the effectiveness of the vaccines. We appreciate our panelists being on, and we appreciate you being on. This is the 35th anniversary of the Orange County Hispanic Chamber of Commerce, and we're proud to bring you events like this today that are important to our community, understanding the vaccine. Without further ado, I'd love to introduce our partner in this, Telemundo, who we have a great moderator for us, Alejandra Ortiz. Alejandra's fantastic telecast person there for Telemundo, and we appreciate the partnership we have with Telemundo and all our panelists actually. And Alejandra, I will kick it off to you.
Thank you, Mr. Franco, and thank you all of you for being here today, this morning with us. It's a true honor for me to be here sharing with you this morning and moderating this panel to better understand and to have a better understanding of everything surrounding COVID-19, the vaccination process, and everything that, whatever concern our community may have, especially our Hispanic community. So let's start introducing our panelists today. And I want to introduce first Dr. Marco Ruiz. He works at MemorialCare, and he chose his career on family medicine. He really feels it is very important to educate his patients on the why when he prescribes a treatment and a care. He believes in complete transparency when it comes to healthcare decision-making, and always has his patients' best interests at heart. And he always, he really treat his patients as if they were like their own family. So welcome, Dr. Ruiz, and thank you for being here this morning with us today. And our second panelist is Isabela Becerra, the Executive Director of the Coalition of OC Community Health Centers. For 20 years of experience, she has been working in the community and public health care arena, both in the service delivery and executive management levels. She's really passionate about working in an environment that fosters relationships with individuals whose collective mission is to increase access to healthcare for underserved populations. And she's going to talk from this standpoint of what is the vaccination process for it right now, about the testing, about COVID-19, about what the county is doing to address all these issues regarding racial disparities and regarding the access to vaccinations, the mobile vaccination sites. And of course, Dr. Ruiz will be talking from a medical standpoint. And we have our third panelist, which is Teresa Razo, and she's going to be talking from a business standpoint as an owner of Cambalache and Roma restaurants. So she'll share her experience with us, how she has been managing everything throughout the pandemic, her business, how she has been going above and beyond with the COVID-19 protocols, and why it is so important, and what happens, for example, if you have COVID-19 cases in the workplace, what you should do, and everything regarding what business owners should be expecting in the few weeks or coming months. So right now, even though we have had a huge progress in COVID-19 cases and deaths, because for the second consecutive day, we haven't seen any reported deaths in Orange County. We still have a lot of work to do. There's still a lot of work ahead of us. So we're gonna talk first with Dr. Ruiz. Last week, we were seeing an average of 304 daily cases. That means the cases dropped 36% from the week prior to that. So what's going on right now in the hospitals? What are you expecting for the next few weeks or months?
So with regards to the hospitals, there tends to be a kind of a lag between the infection with COVID-19 and the development of severe symptoms from COVID-19 and in some cases, eventually death from COVID-19. And so, it's not necessarily like, oh, well, cases are down, yesterday, and so deaths are down, right? Well, not necessarily. A lot of the people that are intubated, that are in the hospitals as we speak right now, fighting for their lives, were infected sometimes 2 or 3 weeks ago, sometimes more than that. A good friend of mine who actually lives in South Texas right now, he's still intubated and has been for about 3 weeks now. He wasn't infected until the beginning of last month, but what happens is that people have these persistent symptoms that gradually worsen. And sometimes people won't be admitted to the hospital for 1 to 2 weeks after the onset of their symptoms when they begin to deteriorate. They become more short of breath, they become weaker. And so I do think that with the improvement in the case rates, I think obviously that's a good sign, because the solution to this is to stop infections, or at least to slow them down. But unfortunately, I think that we'll continue to have deteriorating people that have already been diagnosed, will continue to present to hospitals, will continue to be intubated, and some unfortunately will continue to pass away from this. And so the situation in the hospitals continues to be very serious, very grave. There may not be deaths, for 1 or 2 days, which of course is good, but that doesn't mean that people are necessarily out of the woods. Again, things could change at any moment. Sometimes it's just a matter of the reporting that's done. Sometimes there's a delay in reporting, and, oh, well, we forgot to talk about these 800 cases diagnosed from late December, for example. And so sometimes the tallies can be off, but in summary, I think it's obviously a good thing. I think the fewer cases a day, the better. But I think it may be some time yet before we start to see the death rates and fatality rates decrease as well. And of course, all of this is tied to proper masking, hand washing, social distancing, and ultimately the vaccine, which I assume we'll be talking more about. But that is the one thing that we've got that's going to get us out of this pandemic. So.
And now that you talk about all these protocols about hand washing and social distancing and et cetera, we have been seeing some changes from the CDC guidelines. What about that? Like, they're talking about now, let's wear 2 masks. What do you think about it?
Well, it's complicated. Obviously, it's impossible to really characterize every specific transmission that takes place, whether it's from a mom to their children, kids to kids, adults to adults. The only way that as a scientific professional you can make a statement like that is if you have some data to support it. And so, for example, they may have studied, I don't know the specific data behind it, but the reason these statements are made is because you could conclude that by wearing 2 masks, you can reduce the transmission rate. And so therefore we would say, well, if we want to reduce transmission, we should wear 2 masks. I don't know that has been recommended for everybody. I know that from my standpoint in our particular office here, I think the role is still just the 1 mask. I do think that guidelines can change over time, and that's because the data changes. And I know a lot of people can be very skeptical of that. Well, he was saying this and now he's saying that. Do they know what they're talking about? And the truth is that the data changes. As far as the masking. And then just as an aside, I mean, even back when COVID first started, we had no idea how transmissible it was, how deadly it was. Do we need to shut everything down? Do we need to shut some things down? We were giving them all IV fluids because of the low blood pressure. And then we found that wasn't a good idea with COVID. And so we changed our treatment as we learned more. And so I think this is just one example of that.
And before we start talking about the vaccination process and everything surrounding the vaccine, what about the reopening of schools? We have seen some schools that have had like the green light to reopen. What is your main concern as a doctor?
Well, obviously, the issue with pandemics and any kind of infectious disease in general is that, as people are close together, the risk of spreading rises. And so again, we think back to the beginning where there were, let's say, a couple hundred cases, a couple thousand cases, shutting everything down. And now we have several thousand cases per day, per county, and it's just grown astronomically. As far as reopening schools, I do think that will inevitably carry with it risks of further transmission between friends, friends to their parents to their grandparents, and that could lead to deaths. However, as with the economic fallout from the shutdowns, there are a lot of other consequences to that. And so ultimately, I think a choice has to be made as far as preventing any and all infections and preventing economic fallout, and of course the social and educational impacts on children. So I think the Pediatric Association recently actually came out and said that they recommend that kids go back to school because staying home and being out of school in person is worse than any potential fallout from the virus. And so for that, I say we just have to do our best to maintain our social distancing, wearing masks, washing hands, follow the protocols. But I think a safe reopening is beneficial to all children and to educators alike, as long as we can do it safely.
Yeah, they're saying that it's like worse further because of their mental health. So now let's go.
Absolutely.
Yeah, let's go into the topic of the vaccine. And many people, not just here, but around the world, are hesitating about whether or not they should receive the vaccine because they're afraid of the vaccine side effects, health issues, or underlying health issues. What are your thoughts on it?
I think this is a very common concern, and I think it's a reasonable concern. As long as it doesn't kind of pass into that realm of being unreasonable. And so what I mean by that is that it's understandable. You know, you're sticking a needle in my arm, it hurts, and then my arm is sore. Why would I go through that if I feel fine today? You know, and to that I tell my patients, and this goes for any preventative measures, colonoscopies, shingles vaccinations, all of these things, pap smears, mammograms. I tell them, look, I'm sorry, but this isn't supposed to be Disneyland. It's not supposed to be necessarily enjoyable. We're doing this so we can prevent cancer, prevent infection, prevent death. And so, you know, that's what I tell them. This is a business transaction. It's meant to save your life. It's not supposed to be fun. There may be side effects to a lot of these different things. Colonoscopies aren't fun, mammograms aren't fun. I won't say that I enjoyed the COVID vaccine, but I will say that I enjoyed the process of getting it because I was able to get it and I was able to become, you know, immune from it. Regarding the side effects, again, this is with any kind of medication, any kind of treatment. If I feel fine, why would I rock the boat, so to speak? And to that, I think that we need to kind of look ahead at you know, what other people have said in the past. Well, I'll never get it. I feel fine. And now 500,000 of those people are dead now because of COVID-19. An entirely, most of the time, preventable illness with the right vaccine. With regards to the side effects, again, my personal experience was that I got it in my left arm twice. It's a 2-shot series for the Pfizer and Moderna vaccines. It's a 1-shot series for Johnson & Johnson. I understand that Johnson & Johnson recently got emergency approval from the FDA. I can't speak too much towards that. Yeah, they're going to meet, I believe, on Friday to officially certify that. But my experience with the vaccine, it really was the shot was a shot. It is what it is. It goes in, it comes out, you're done. They monitor you for about 20 minutes to make sure you don't have any kind of acute reaction. I did not. Most people don't as well. The day after, my left arm was pretty sore. I'm not going to lie. It was a little on the sore side. And to that, I say, good. I want it to be sore. I want to know that it's working. I want to know that this is the real deal. It would have worried me if I had had no side effects, to be honest with you, because the way that these vaccines work, as some of us may not know, is that it fools the body into developing a defense against COVID. It tricks your body into thinking you got the real deal. This is it. This is what's going to do you in. And the body is going to do its best to defend you. And it turns out not to be the real deal, but just bits and pieces of it, in this case, mRNA, a part of the genetic material.
Yes.
And, so that's why you have the pain. That's why it's a little sore, because your body thinks it's the real deal. And just as quickly as it came on, it went away. My second dose was a little rougher. Again, I had arm pain for about a day. I had chills for about 3 hours that day after, and then it went away. And now I've got 95% protection. And so if anybody's concerned about side effects, number one, I would encourage you to think, is a sore arm and mild fever and chills worse than what ends up happening to a lot of these people.
That's normal.
Yeah, and it's normal. It's accepted. It's desirable. We want proof. I want proof that I know that it's working.
That it's no way, that you're developing the antibodies in your organism.
Absolutely. How could you not? I mean, if you develop a response like that, your arm is sore, you get the chills for a day or two, that's part of the process. And that's how we put an end to the pandemic.
Exactly. Thank you so much, Dr. Ruiz. We're going now with Isabela Becerra. She's the Executive Director of the Coalition of OC Community Health Centers. And Isabel, welcome. And you'll talk to us a little bit about vaccine eligibility. Who is eligible right now, in which phase we are right now, because we know the county will set aside like about a third of all the new vaccine shipments that are coming for school employees, for grocery store workers. Tell us a little bit about that.
Right. Well, first and foremost, thank you, everyone. Happy to be here. Vaccine availability continues to be an issue, right? So we are already starting out the gate with less than what we need. The demand is definitely more than what the supply is. And officially this week, we expanded into phase 1B, so that includes all the individuals that you've just listed. And we were instructed, we as part of the community healthcare system, which we comprise 23 organizations and 80 locations across Orange County, all of them licensed by the state of California. They're nonprofit entities, and half of them are federally qualified, which means that they are funded by the federal government to ensure that everyone has access to healthcare, whether you're insured, uninsured, legal, undocumented, whatever the case may be. We are there to ensure that you get the right care at the right time by the right providers, because the cultural and language capability mirrors that of the population. So we get a weekly supply of vaccines for our community patients and also the surrounding individuals that we partner with in the communities. We were told, as of this week's shipment, we were to reserve 30% of that shipment for the expanded categories of the food and agricultural workers, the childcare providers, and the educators. Now, the educators, through the Orange County Department of Education, they're getting a special allotment of vaccines so that the teachers and whatnot can go to these special locations and get those vaccines there. And I'm very happy about that, because I think that further assists the community health centers from determining, prioritizing who and how much of that 30% goes to each of these three categories. The concern that we had while we expanded that category is that we still have a lot of seniors that are 65 and over that have not been able to get vaccinated. And so I definitely agree that the 70% that we are earmarking for that category remain as is, because as I like to say, we still have a lot of our viejitos that we have not been able to vaccinate. And we need to figure out, how do we do that? How do we make that happen? Because they can't go to the super pods. They either don't have the transportation, they don't have the tech savvy or awareness of how to sign up. They don't understand the ebb and flow of the cancellations due to weather and whatnot. And so I think that at the community health centers, we're either your doctor or we are the community health center in your neighborhood, or we are partnering with the organization that you go to, like the senior center, the schools, the churches. And so we want to make sure that they know that we are still there and that we're still vaccinating, and that we want to prioritize them and do whatever it is that we can, including transportation, to have them come to the locations.
And that was exactly my next question, because according to the county's own vaccine progress data, in Orange County, white people make up 46% of the people with at least one vaccine dose. So far, until now, Latinos make up just 11% of the people that have been receiving the vaccine. So what is the county doing to address this issue, especially what you just mentioned, the people that have transportation problems, and how, or what is the county doing to give more access to this vulnerable communities?
Right, so the equity lens, right? And I believe that, again, working with the community health centers affords them that opportunity to right away mitigate that, right? We are hiding in plain sight in terms of the solution of how to address that. Now, we're not the only solution, and that is why they also opened the Santa Ana College Medium Pod just recently. And again, all of that is still subject to availability of vaccine because, as you know, it closed a couple of days last week because of the blizzard we had in the Midwest. We weren't able to get shipments. Nobody did last week. And so we had to close down, or they had to close down those super pods and all the medium pods. Fortunately, the health center still had vaccines and we still had events. But again, it's at a smaller scale. They're also working, I'm a part of the vaccine task force with the healthcare agency. And so we have meetings once a week, sometimes over the weekend, to have these type of discussions, to look at the data. And by the way, the Latino number went up by 1%. And although that's good, it's not enough, right? We need to make sure that we continue to work that angle strategically and focused in the neighborhoods. And so we're also working on mobile pods. So I mentioned the churches, the senior centers, the schools, where we are taking some of the mobile units. The health centers also operate licensed facilities on wheels, and it's like an RV, and we can go to the schools and we get extra supply of vaccines, between 200 to 500 vaccines per event, so that again, we are taking the vaccine to the community versus waiting for the patients to come to us. Also working with organizations like Abrazar, who is specifically a transportation CBO that we partner with, so that when the mobile pods are scheduled, they are given lists of individuals and addresses of where they can go and pick folks up and bring them back.
Isabel, where can people go and register to have the vaccine dose?
So again, you know about Athena. So Athena is the application that is used by the county, for the super pods like Disney, Soka University, and Santa Ana College. We at the community health centers are not using Athena because we, again, are prioritizing our patients. And so we know where they are, we know who they are, we have their medical records, we know the comorbidities or not that they're experiencing. So we're in-reaching to our patient population. The folks that we're working with at the other sites, like with Latino Health Access and the churches, those organizations are given slots, if you will. And then they go and do the outreach. So we tell them, we have 300 vaccines. You go out and find the individuals. You go to the supermarkets, go, to the laundromats or wherever it is that you are going to engage in outreach. And then you sign them up manually. Then we can go in and provide the vaccinations. And then we turn in that information over to the healthcare agency. The healthcare agency then enters that data. So we're not using that application, although they're really insisting on it. We have found that it's a barrier for the target populations that we're working with. We understand why they need it. We understand that in order for us to see that there is a collective increase in the number of Latinos or any category of individuals that are getting vaccinated, they need that data. So I understand why they need it. But the reality of it is it's a barrier. And so we need to figure out another creative way to get them that data.
Perfect. Thank you so much for your time. And Teresa Razo, it's a restaurant owner. Teresa, good morning, welcome, and thank you for being with us here today. Tell us a little bit, how have you managed the pandemic with your restaurant, with your business? How have you been going above and beyond with all these COVID-19 protocols, and why?
Well, thank you very much for having me. It's a pleasure to be here with the incredible panelists here and hearing all this information. It's wonderful from medical perspective, and also the vaccines, which is what we call the little light, at the end of the tunnel. So for us, we've taken it really serious from day one. We've always looked at our business, not just as a business, but as a family. So we're very concerned about our staff and also of our, customers that come in here. Families come in, elderly, kids, everything. And, I just want to do the right thing. Like if my kids and my family were going to come to eat here. So yes, some people have said we've gone above and beyond. We followed all the guidelines that we were given by the state, by the CDC, by you name it, and even beyond that. When we shut down and then they said you can reopen up again, we didn't reopen right away. Okay. We wanted to go through certain protocols to make sure, and certain rules to make sure that our staff and customers were going to be protected. We want to always be part of the solution, not part of the problem. So we decided to take that step and that, put our values before business and anything else. So we even did a protocol of we decided, okay, all the plates that you pick up from the outside have COVID, period. There's no questions. So every single person or staff that picks up a plate or a fork or anything that picks up that is coming from a customer, it has COVID, period. I mean, so I have signs all over so that the staff knows anything. And once they touch it, they don't leave it anywhere unless they drop it off in the right place. And we put a bucket of disinfection. So all the dirty plates go in that bucket before even a dishwasher touches them. And then we made a routine where all the food comes out one way and all the dirty plates come in one way. So it never crisscross, or you have no way of contamination there, just to be on the safer side. And protected all the staff, gave them everything. And now my staff is even asking, what about the vaccine? And, we're hoping that that comes in place for us too, because I've always thought, everybody's getting vaccines and this and that. But if you think about it, it's not a fair game here with the restaurants, because the customers are eating without a mask.
Yeah.
And we are the only ones having a mask. Everyone else has a double mask. Even if you go to the store, if you go to the grocery, everywhere. But at a restaurant, you're still talking to a customer and they don't have a mask. So that's a big concern for us, and a big hope also.
So your waitresses use a face shield to protect themselves
Some
on top of the mask?
A mask. I brought him everything, and I said, however you feel, whatever you feel more protected, but here's everything. There's shields, there's masks, we have glasses, goggles, just anything, gloves. And I said, whatever feels, best for you. And we've been, since probably end of November, December, double masking, most of us, just to be on the safe side. We've had a lot of customers that got infected, and unfortunately we lost one of our musicians, and several customers that we've lost also. So, it's really hard for the staff through the whole month of end of December and January. And then again, when they said you can reopen up again outdoor, we took an extra week to make sure, again, our protocols were in place. Our staff was physically, emotionally, and mentally ready to open and do this, because it's not just about money. It's not just about business. Staff needs to be ready to do that too. And we've had, we've lost some close people. So I was not going to push them to say, let's open.
Teresa, what other recommendations you have for other business owners navigating through this environment like you?
Well, definitely, it's a struggle. It's probably been one of the biggest roller coasters of my life, because you feel like, oh my God, you can see everything, everything's looking well, and then suddenly they bang, way down, and you have to start all over. But it's been such a learning experience also. I just say, for us, and it worked very well, we decided to put faith over fear and values over business. And that makes it very clear and easier on what decisions, what to do and when to do them. Because, at the end, our business is hospitality, which is, servicing people. So what is your main thing you have to take care of? Is people. So if we take care of each other, everything's going to be okay. So we decided to just take that route and put everything in place. We know it's not 100% secure, but we wanted to make sure that from our perspective, we do everything we can to do the best and also keep going, business, because a staff needs to make the income to feed their families and stuff. And we've been very blessed. We've been very grateful. Our community has outpouring support to us. And we saw that, and we just turned around and also started helping homeless, families in need. And it just, it's not a year to take advantage or to do the business the same way. It's a year to reinvent, and it's a year to take care of each other and just survive and take care of each other. And that's what we've, I would say to each owner, just don't try to make it like your best year in numbers. Try to make it your best year as a person, as a community leader, as a business itself, as your values. That will, I can already plan for another 20 years just following the values.
Yeah, thank you so much, Teresa, for sharing with us this valuable
you.
experience. And I want to ask Isabel if you have any suggestions about the resources available for business owners or for, other businesses that are struggling through this same situation.
Well, I wanted to respond. Thank you for the opportunity. In terms of food and agricultural workers, Teresa, your employees would most definitely qualify under this expanded category. Anyone who's handling food in any way, shape, or form. So I'm talking about the grocery store workers, the restaurant workers, the paleteros, the DoorDash drivers, anyone, right, that again is handling food. And this particular category, the healthcare agency has agreed and authorized that the verification that we require when you come in for that vaccine does not have to be a pay stub if you don't have one, because we know that in our communities, sometimes it's difficult, to have that verification, especially if you're working for yourself. And so particularly at the community health centers, they are accepting a self attestation form, right? So that they say, I work for, I'm a taquero, and I have my own, gig on the side or whatever the case may be, because we don't want that to be a deterrent from individuals reaching out to get a vaccine. We know that they do not have the luxury of working from home like all of us do,
Yeah.
right? A lot of us, I feel very privileged to be able to do the work that I'm doing for the community that I'm doing it for. But I also recognize that I can do that from the comfort of my own home. And I'm not in the mountains. That's just a fancy little background. I'm in my
I
home.
was going to say that.
No, I'm not.
Background.
But these individuals, for example, I think are our most vulnerable community, and they probably are the ones that are going to have the hardest time proving that they are in the food industry. And so I just wanted to make sure that the folks are aware of that for this particular category, the county has relaxed its documentation requirements.
Okay.
Great.
And Teresa, are you planning to have like mandatory, like the vaccination process as mandatory for your employees? We have seen other business owners across the country having struggles and problems with their employees because they refuse to have the vaccine, and they have been even fired from their work.
Right. Well, I think we all have to, like I said, work the same way so that we can take care of each other. And, maybe, some of my staff are younger and they feel that they're invincible and or already got it. I've had two that already just from outside sources got it, and they weren't even working because we were only doing takeout. So they got it when they were out of service, and they feel, okay, well, now I got it, I don't need it. I'm like, no, okay, let's give you all the information. I hate, we haven't even thought about that. We just heard about the vaccines coming out, and I would say about 99% of my staff is like, where do we go, what can we do? And like I said, we've always had that mentality, and I've always pushed that in the values of the whole system in our restaurants, that we have to work together for everybody. And maybe it's not for us, but it's so that we can help the rest of the community, go forward. Because if we don't cooperate together, it's not gonna work, And like you said, that like Isabel was saying, the taqueros and stuff, and they have a lot of interaction, a different way of interaction in communities, so that can even spread it even bigger, or just information about how it spreads, what happens, when to do, what to do. It's crucial. It's very crucial, and our community needs to really understand the severity of this. I think by now they know because of all the closures, but I'm hoping that I don't have to go that route, and that everybody will say, where do we sign up? That's my feeling right now. But I think everybody has the choice to do that, and to really look at the value of both ways. And it's for me, I give them opportunities here to maybe move on the career, but if they don't want to, then that's different. So it's their choice.
Okay.
But Isabel, tell me where, and I'll sign up.
Thank you, Teresa.
Yeah.
So
Can I just add one thing? I'm
yes,
sorry.
of course.
So, the reason why there is no main number for where can I get my vaccine at the community health centers is one, because there's not enough to go around, right? I started by saying that there's just not enough vaccine. And so we want to be strategic and make sure that we don't overwhelm any one community health center who, in addition to providing vaccines, are still seeing patients. During last year, we transitioned into telehealth. But now we're opening it back up again. And so they're still seeing patients. The other is that we're targeting, again, that population first and working with other CBOs to collect lists. There are CVSs and Rite Aid pharmacies that are getting a special allotment separate from what the county gets. You also, if you happen to be lucky enough to be insured, you can also get it through your provider now through Kaiser. I don't know, Dr. Ruiz can talk about how you get it at his shop, because I know that they also get their own supply of vaccines. There are what we call multi-county entities. These are large systems that are in multiple counties throughout the state. They get their own deal. They get their own supply. The little bitty supply that the community clinics get are a special allocation from what the county gets. So I can't stress enough the fact that there are not enough vaccines. And so we need to be strategic about how we deploy them and who we work with and who we partner with. Now, absent you having a connection with one of these CBOs that can maybe get you on a list, there is still Athena. There's a Athena app, and I can share what the Orange County Healthcare Agency's website is, maybe on the chat. And we can, you can go and sign up for your staff. That's, again, tax savvy, and you have the patients to sign in, and they put you in a waiting room, and they'll get to you eventually. And so I think that would be one strategy. The other strategy is maybe, we can have a conversation about how we have a special event at your particular location. Maybe we do a mobile pod at the restaurant. Maybe we collect a few restaurants together and we join efforts. So we have to be strategic in order to be able to be laser focused like that. Otherwise, it's going to be very hard for people, to get a vaccine, especially when after next week, the comorbidity criteria is going to open up. So people with, certain chronic conditions, and again, Dr. Ruiz can talk about that as well. Once that opens up, forget it. It's going to be chaos because we're not going to get additional vaccines. We're going to have to still try to manage that expanded category with the limited number of vaccines that we have. And so to that, I say we just need to work stronger and better together in order to protect our communities.
Right.
Thank you, Isabel. So I'm going to start just a little Q&A. If you have any questions, you can send it to me. But right now we do have a question, and it is addressed to Dr. Ruiz. And it says, Priscila Lopez wrote, if a person has chills, fever, body aches after the second shot, should they just write it out, or can they take Tylenol or Advil for it?
So there has been a little bit of discussion. Obviously, that is, those are known to be some of the side effects from the vaccine. They tend to be fairly mild. Sometimes they can be a day, sometimes they can be 2 days. Again, like I mentioned, this is how it works. With regards to what they should do for Advil and Tylenol, there was some discussion about that, of whether or not it would dampen the immune response. I think the latest recommendation is that it's okay to take Tylenol or Advil if you need to for these side effects. That is the latest information that I'm familiar with. Obviously, if it persists, if you have any other questions, I do encourage you to communicate with your doctor. I know we here at MemorialCare do offer video visits with pretty short wait times. So if there's ever any questions, I recommend doing that. But as far as Advil, Tylenol, Naproxen, Aleve, all those things, I think those are reasonable options if you do have those side effects.
Perfect. Thank you, Dr. Ruiz. So the next one is not precisely a question, but it's like a comment or a recommendation. And it's from John Gutierrez. He says, will be great to share that they recommend that all staff in a business don't get all the vaccines on the same day or same day due to side effects hitting all one business. So this is what we were told, and we work in healthcare with our OC hospice company staff.
Mm-hmm.
I know John personally, and with his great company, OC Hospice, here in Orange County. And I believe like they signed up for, and then all of their staff got them all one day. But what if, 2 or 3 get sick or something, that you can't continue, or, it can interrupt your business, and patients, for example, for him, can't wait, and he signed up for a company. That's what I was thinking. Maybe for restaurants, you can sign up as a restaurant and say, okay, certain days, or give them, give them times, slots. But it's a good recommendation, and thank you, John Gutierrez from OC Hospice.
Thank you, John. So now we have a next question from Maria Rubalcaba. She says, do we need, and that's for Dr. Ruiz as well, do we need to take a COVID test and be COVID clear before we get both vaccines?
That's a very good question. So for starters, obviously there are a lot of people that can get COVID-19 that may have mild symptoms or no symptoms. And then obviously you have the other side of the spectrum where people get very sick. With regards to the vaccination, first of all, we don't need, the CDC does not recommend getting a COVID test to confirm that you do not have COVID prior to getting the vaccine. However, if you do have COVID, say you got COVID on the 1st of January, or let's say the 1st of February. First of all, hopefully you're okay. And second off, they recommend waiting at least 3 weeks after, actually, no, I'm sorry, I misspoke. They recommend at least 3 months after getting COVID-19 before you get the vaccination, the 2-part series. They still do recommend that you get it, but they recommend waiting about 3 months after getting COVID-19 to get the vaccine. On top of that, just as an aside, a lot of people ask if they need to repeat COVID testing after they've had COVID, and it has to be negative before they go back to work. The CDC does not recommend that. The CDC recommends at least 10 days since the onset of symptoms have passed and that the patient is feeling better, has had no fever for at least 2 days, 48 hours. And then regardless of COVID test, patient is cleared to go back to work. Patient is no longer considered particularly contagious. The COVID test can remain positive for some time after symptoms have resolved.
Okay, Doctor, and I'm gonna close this virtual forum with Rosie Felix's question asking, I was told not to take Tylenol or Advil before the vaccine, but only after and only if you have side effects. Is that right?
I think that in theory, again, this isn't necessarily concrete evidence to suggest that Tylenol or Advil would dampen the effects of the vaccine or mitigate the positive effects. I think it's more of a theoretical possibility where Tylenol or Advil could, in some cases, in that they reduce inflammation or they reduce pain, they could also limit the body's response to whatever's happening there. There are some very specific examples of this in the context of using steroids or IV immunoglobulins, stuff like that for other treatments. But for Tylenol and Advil, I think the evidence is less concrete, less certain. I would probably say it's better not to take them for at least a few days after getting the vaccine. But if you must take it, you can. And I think that you will still be fairly well protected by the vaccine. So again, a little bit of a gray area. There's no real hard evidence to suggest either side yet. But I think it's better not to, just to be safe. But if you have to, you can.
Perfect. Thank you so much, Doctor. Is there anything else you want to add before we close this forum?
Well, I will just say that, obviously we've all been through a lot as far as business-wise, economically. I will actually say I've been to Cambalache restaurant not too long ago. I was very happy with the $2.50 empanadas. They were delicious. Definitely worth more than that. One of the best experiences restaurant-wise. But I think we've all been through a lot from business standpoints, family members. I think we all, at this point, pretty much all of us know somebody who's been affected by COVID-19. I myself have had a lot of patients die from it. And I think that you're right. It's going to take a concerted effort from all of us to see an end to this thing, because the worst that can happen is the rollout of the vaccine is so slow that the other resistant variants of the virus spread. And so this whole vaccine struggle was for nothing, and it no longer protects you against the new variants. So we have a unique opportunity right now to vaccinate people en masse and hopefully just, reduce the amount of transition and eventually just get rid of COVID altogether, eradicate it. I think it's possible, but it is going to take a concerted effort on everybody's part.
Time. Thank you so much for your time and your valuable experience, Dr. Marco Ruiz. Let's go with Isabel to see if you want to do or make any closing statement.
I would like to just reiterate that we're not out of the woods yet, and I would highly encourage individuals to not let your guard down. there is a light at the end of the tunnel, but it's still a little bit far away. And we want to make sure that we maintain the progress, although steady, but that we maintain it and not have individuals start, not wearing masks, doing the gatherings and whatnot. We've already seen it happen, right? In July and December, we got a little bit comfortable and look what happened. So I would just highly encourage individuals to continue to practice all the safety measures and also understand that more vaccines are coming. We just have to demonstrate that we're actually vaccinating. And so it's sort of a catch-22, and which is why we need to continue to work through systems like Athena and like what Blue Shield is doing as a third-party administrator now for the state, asking us to use My Turn, which is another application, right, that we're going to have to struggle with. But I understand why the need is there, and just bear with us, and together I think we can make it work. My personal commitment is to the underserved communities, particularly in the Latino community that has been hardest hit, and we'll continue to advocate not only to get more vaccines, but to continue to be prioritized to be the vaccinators for our community.
Perfect. Thank you so much, Isabel Becerra. And Teresa, do you have like a last invitation for business owners?
Yes. Well, first of all, it was a pleasure to be here with everybody, and I'm so happy to hear that Dr. Ruiz had a great experience at Cambalache, and we hope one day we can all meet there, and not be afraid of, the COVID or anything, and celebrate. But, I just say, like, hang in there, like Isabel was saying, there is a tunnel. It's a long tunnel still, but you could see the light. And once again, if we stay together and we do things together, also Dr. Ruiz mentioned it, it's going to be a collaboration of everyone to really get out of this. And the faster we do it, the better for not this variants to hit us. And I would just say, just stay strong. I think the hardest part has already been in the back, because we now understand it more. Now we have little tools to work on it, and let's just work together on it as a community and take care of each other. It's just what we do is, I always tell my family and my staff, okay, what are you doing to take care of others? If you're doing that, you're going to take care of yourself. It just by default. So just keep doing that. And also, we are available if anybody needs to talk to us or, put protocols in place. I've worked with a couple other restaurants, small businesses, helping them also, to strategize, or also, making sure that we can get through this. I work with the Orange County Restaurant Association and also the Fountain Valley Restaurant Association. So that's something maybe with Isabel, we can work together for restaurants to bring something out for them. And we're just here, we're available. You can find me at Cambalache or Villa Roma, and we're happy to help any way, form, or shape.
Thank you, Teresa, for your time and for sharing your valuable experience and all what you have gone through this pandemic. I would like to invite all of you before we all go. Next Thursday, we're going to have this forum, but in Spanish for all our Hispanic community members. So vamos a estar hablando de lo mismo, es entendiendo el COVID-19 y entendiendo el proceso de vacunación y todo lo que esto conlleva, tanto las vacunas, quiénes son elegibles y quiénes no. Y vamos a tener toda esa información el próximo jueves, también organizado por la Cámara de Comercio Hispana del Condado de Orange. So to the Orange County Hispanic Chamber of Commerce, thank you for organizing this important forum. It's so important for all of us. Information is power. And specifically, many people don't get their vaccine. Many people even get infected because they don't really know the real information, or, what was Teresa just saying, like, let me explain to you, like, let me inform you well. So la información es poder. So thank you so much, all of you, for being here with us today. And I hope to see you next Thursday.
Thank you, everybody.
Thank you.
Thank you, Alejandro.
Thank you.
Fabulous job, everyone.
Bye-bye. Thank you, everybody.
Thank you,
Bye-bye.
everyone.
And thank you for your
Take care.